Welcome everyone. Thank you for joining us in this webinar titled Ethiopia Results and Perspectives Towards the 2030 Agenda Realization. The event is organized by the Embassy of Italy in Ethiopia and the Italian Agency for Development Cooperation, the Addis Ababa office, within the Festival for Sustainable Development promoted by ASviS. I am Adele Manassero, the Communication Officer at AICS Addis Ababa, and I will help to facilitate the event. Before we start, I'd like to give you just a couple of details and housekeeping rules. The event is divided into two parts. In the first one, we'll have speeches and presentation by authorities and development partners, while in the second one, we'll have a participatory discussion open to all the participants, so to all of you. During the presentation, we kindly ask you to drop your comments and questions in the chat, adding your name. They will be addressed at the very end of all the presentation to give equal space to each presenter. Instead, during the discussion, all the participants can ask to speak by raising their virtual hand and unmuting their mics. So the webinar, as you see, is video recorded and will be uploaded to our online channels afterwards. I'll be here throughout the webinar, so feel free to drop me a private message in the chat if you need any of my technical support. And now, since Mr. Panarello is not here, I would kindly ask our second authorities to speak. So Ms. Isabella Lucaferri, Desk Officer East and South Africa from the AICS headquarters. Isabella, welcome, and the floor is yours.
Okay, so can you hear me?
Yes, we can hear you loud and clear.
Mi sentite? Can you hear me?
Yes.
Yes, okay, thank you. Okay, so I would like, first of all, to thank all the participants to this event. So the Embassy of Italy, the UNIDO representatives, representatives of the Water Resources Development Fund, representatives of Province of Trento, and the Italian CSOs, and my colleague from the Italian Agency for Development Cooperation. First of all, let me introduce myself. I'm Isabella Lucaferri, and I'm currently the Geographical Desk Officer for East and South Africa at the Italian Agency for Development Cooperation, and newly appointed as head of Addis Ababa office. And so I expect to take in office in about 2 weeks. So with many of them, many of you there, I think that we will have numerous occasions to hear and to see each other. As part of the Sustainable Development Festival 2020 promoted by ASviS, I'm particularly grateful to the Embassy of Italy and to the Addis Ababa office for organizing this webinar as a part of, it's a point of check, no? and a roadmap for the realization of Agenda 2030 in Ethiopia. And highlighting the goal of eradicating poverty by 2030, the agenda focuses in an integrated development and people, planet, partnership, peace, prosperity, are the principle of the agenda and of the sustainable development goals, whose universal character, I think, represents a cultural change and a challenge. And all countries are equally in goals, and for that they share a common path and a common goal without leaving no one behind. And the best way to prove it it's to counter the ongoing pandemic together, I think. And Italy is committed to achieve all the 17 goals, but today we touch the ones linked to 3 important initiatives that are being implementing in 3 important sectors for the Italian development cooperations. The first initiative that will be presented is a Sarveti project. And the second one is the technical assistance project for upgrading Ethiopian leather industry. And the third one is urban wash. So we will hear from our implementing partners how things are going. With regards to Ethiopia, with whom we had a long-standing relationship from dating back from 1980, I would like to outline that the country framework that are ongoing now has embraced the spirit and the value of the Agenda 2030. Because the country framework aim at contributed to an integrated, inclusive and sustainable development, and strengthening the country ownership, and as well as promoting partnership for the benefit of all. Finally, before I end my speech, I seize the opportunity to express my gratitude to all our stakeholders for their efforts and cooperation in achieving the project results. And I thank all the speakers, the organizers, and the participants who joined the webinar. And I wish you a fruitful event. Thank you.
Thank you, Isabella Lucaferri, for these opening remarks. I confirm that even Mr. Pietro Panarello is still trying to access, so I suggest and I'm going to introduce the first presenter, that is Lorenzo Biazetto from the Autonomous Province of Trento, Development Cooperation Officer, and she's the project manager from Sviluppo. So Lorenza, the floor is yours.
Thanks. Good morning to everybody. First of all, I would like to bring the greetings from the Autonomous Province of Trento and the Development Cooperation Office, which I represent here this morning. It's really an honor and a pleasure to participate to this webinar that offers the opportunity to present our activity, not only Sarveti, but in particular Sarveti, in the perspective of the objectives of the Agenda 2030. I'll try to be as concise as possible because we have with us some really authoritative speakers such as Piero Poletti from the Bruno Kessler Foundation and Alessandro Domanico from Informatici Senza Frontieri, and also Atomer Gayamane from Doctors for Africa, QAM. Because as Isabella has just said, we have to understand today how things are going, and those are the people who are really working in the field. So I'll go through the slides we prepared together very quickly. If Adele or Laura, I think, can show them. I don't know if you see them, otherwise I can open mine.
Laura, I think you need to remove the screen sharing and put it again because you are still seeing the first slide.
I can use mine if you want, but it will be easier for you to follow.
Yeah, we have the full one with the whole presentation. So yeah.
Anyhow, the first slide was about the activity, was meant to present the activity of our province of Trento. The province of Trento has a very long tradition of solidarity and commitment to peace and sustainable development. Think that we have more than 200 associations of volunteers which are active today worldwide in Latin America, Asia, Eastern Europe, and Africa, of course, where we have a very wide board involving many different countries. This happens with the financial and operative support by our offices. The province of Trento has also access to funding from other donors, including, of course, the European Union and AICS, to carry out all the interventions and implementing them together with other public and private institutions, both local and international. So one of the main objectives of our working is to build long-lasting partnerships, also in terms of mutual knowledge and sharing on values that we'll find that we can find in the Charter of the United Nations and international treaties. The second slide that I think you can see now, very good, is about Surveti. You can see our logo, which has been just fixed by a school here, some boys in a school up at the top of the slide. So, the word Surveti, for those who doesn't know the project, comes from the matching of the two words surveillance and Ethiopia, of course. And it's a project about strengthening the system of surveillance and control of infectious diseases in Ethiopia. So the project consists in the study of the data related to the spread of infectious diseases in 3 pilot districts in Oromia region in Ethiopia, and the consequent elaboration of mathematical models aimed at the definition of containment measures. That's the main objective of the project. If we want to develop it in 3 points, we can talk about the strengthening of the capacity of the local health and hospital authorities in the field of epidemiological surveillance, and countering the spread of epidemics and infectious diseases by strengthening the capacity of institutional and health personnel. So we have a lot of capacity building activities. And then at the 3rd level, we promote and transfer the knowledge and good practices coming from all these activity, both in Ethiopia and in Italy. The objective is to let people know about the project and to know what we can do to counter the infectious diseases. I would like to end this point stressing that many of the data that have been delivered by the researchers in Ethiopia have been used at a national level here in Italy for the preparation of the anti-COVID plans. This is a point which is very, very important, and it will be made by Piero Poletti, a researcher and scientist from the FBK Foundation, the Bruno Kessler Foundation, who is involved in the national control panel working on COVID. For what concerns the 2 main goals of the Agenda 2030, we pointed out goal 3, the one about, of course, healthy lives, health. So ensure healthy lives and promote well-being for all at all ages. And of course, you will see in a while how the project aims to effectively combat the spread of epidemics and infectious diseases through the training of local health authorities, health personnel, and community. This training will ensure continuity to the project beyond the end of the project itself in the year which will come. Goal number 17, Revitalize the Global Partnership for Sustainable Development, has as main point the Hansen, the Global Partnership for Sustainable Development, putting together many stakeholders. Here I would like to mention just that the most important for us who are represented here today, who are, as I mentioned, FBK, Bruno Kessler Foundation, Doctors for Africa, QAM, here we have Atomerga, and Alessandro Domanico represents the Informatici Senza Frontiere. And then we have also the Provincial Agency of Health Services in Trento. So I think these should be more or less the main points of the project. I would like to leave the floor to our colleagues and partners who are really working with passion and professional spirit.
Thank you, Lorenza. So now I introduce Piero Poletti from the Bruno Kessler Foundation. He's a research scientist, as Lorenza already said, and he specializes in infectious disease modeling. Piero, can you hear us?
Yes, sure. Hi, everyone. I'm Piero Poletti from Bruno Kessler Foundation. I'm a mathematical modeler and dealing with modeling infectious diseases, both in Italy and in Ethiopia. What I want to say is something related to the COVID-19 and how the data that we were collecting from the Southwest Shoah zone are used currently to assess the epidemiological risks in sub-Saharan Africa. So essentially what we know from the epidemiological estimates available from also other countries is that the clinical outcome of COVID-19 is strongly dependent from the age profile of the population. Especially actually we know that children have a relatively low risk of infection and disease compared to adults and the elderly. And of course, given the young age structure of sub-Saharan African countries, we would expect that a lower fraction of critical cases will occur in this type of settings. However, it is also known that the SARS-CoV-2 infection, a large fraction of this infection remain asymptomatic, which essentially means that they are unobserved. They are symptom-free subjects. So it is possible and plausible that in sub-Saharan Africa, the epidemic will remain at a certain point, for a certain point, unobserved. However, on the other hand, we know from other data that we were collecting within the Sorbeti project that, for instance, for measles, using surveillance data, we get the information that the mortality rate increases with distance from the hospital. This is because of an heterogeneous access to health facilities with a distance that increases the undetection rate of cases. Essentially, this means that we will have some problems in terms of how we can provide adequate treatment or contact tracing of cases in such kind of settings. Of course, the analysis of epidemiological data from these type of settings suggests that the transmission is mainly driven by contacts between young individuals, so that the school closure can dramatically decrease the transmission. So I will remain on this type of intervention. But of course, we have to consider how we can fight this type of emergency. And what I suggest is that the tools that we have are essentially knowledge and intervention. The knowledge is required to assess what kind of dynamics we would expect. And of course, intervention is something that we want to put in place to reduce the transmission and disease burden for these settings. But however, this kind of approach, the increase of our knowledge about the diseases, the social dynamics underlying the transmission of the diseases, and the data, the collection of suitable data to analyze the epidemiological situation is something that is not related explicitly to COVID, but is common with other infectious diseases. So in a certain sense, I think that The project Surveti, the surveillance system, increase the strengthening of the surveillance system is crucial to fight not only COVID, but also the next epidemics. Thank you very much.
Thank you, Mr. Poletti. Thank you very much. It was an interesting insight on COVID. And we now give the word to Alessandro Domanico, Project Manager and Software Analyst and Developer from IT Without Border.
Hello, everybody again. I'm Alessandro
Welcome.
Domanico. Thank you from Informatici Senza Frontiere. We have been working for 9 years now, almost 10 in Ethiopia, in the Oromia region and the Tigray as well, and for 2 years on the Soveti project. Our experience, we know quite well the criticalities in data collection in the system of Ethiopia. What we have done, we used to do is to enforce, to strengthen it, the real-time data collection, because we believe that the quality of data is achieved when as much you collect the data at the source. So in the Ethiopia system, we see that in the recent years the growth of the country of Ethiopia is very evident, and many government actions are already in the wake of the 2013 agenda. In the case of Soveti project, the activities are complementary, let's say, to the government one, with a transversal component, as FBK was suggesting before. Just to be shortly, from one side, there is an introduction of the National Governmental Information System, the PHS2, which aims to reach the individual structures, facilities for an integrated and homogeneous data collection. And from the bottom, from the other side, there is how those data are collected and generated in the specific facility. So what we do is, since 9 years now, especially in the Seljuk hospital where we work for the Soveti project, is to improve the data, the real-time data collection, and to provide the necessary tools, IT tools to specialists in order to better assess cases and from patients. The outcome is an aggregated data in real time, and within this project, we also managed to have a geolocalized system. So for this data, also geolocalized, provide additional information from an epidemiological point of view. For the COVID emergency, the prevented planned on-site missions that we typically do for 2-3 weeks have been prevented to be conducted, and these are necessary for supervise the status of the activities and for the capacity building point of view, to train people, to train the staff. However, it was possible to continue with the planned activities remotely, thanks to the IT tools we put in place, and we had remote operability and remote support and remote training as well. Thank you.
Thank you, Mr. Domanico. We now give the floor to the last speaker on the same project, Surveti, that is Ato Merga Yemane, Healthcare Director of Southwest Shoa Zone. Mr. Yemane, can you hear us?
Sorry, I don't think Mr. Merga is online. He was there a moment ago, but I'm not seeing him. If he's not available, I can say.
Absolutely.
Yes.
Then if he connects again, he can jump in after you. Absolutely.
Okay.
Introduce yourself as well.
Okay, thank you. So I am Ademe from Dr. Swiss Africa Quam. I am the head of program for Dr. Swiss Africa Quam. Mr. Merga is head of Southwest Shoa Zone Health Department. He was online a moment ago, but I think now he's disconnected. So just to say on the project that we have been implementing with FBK with financial support from AICS on the PAT project. That project is really very helpful in terms of building the capacity of healthcare workers to respond to epidemics. With that project, we have been, giving training to healthcare workers working at the zone, at the Warada, and at the health facility levels. We have been building their capacity in, collecting data, analyzing data, and using the information available at local level for decision making, especially data related with epidemic-prone diseases. And this training actually really helped the zone to respond, to give response, immediate response for COVID-19 epidemic. Because when we started the project 2 years ago, there was no COVID. COVID started, after we started the implementation, after we gave training to healthcare workers on how to respond to epidemics. So that training really helped the zone to respond quickly. The other thing is with this project, we have been equipping public health emergency departments at Warada, at health center, and at zone level. So we gave them computers, we gave them shelves, furniture, and other materials related with public health emergency. So we supported the district health office, the zone health office, and health facilities in the zone. We have been also conducting supportive supervision. So we pay supportive supervision every quarter to the waradas, to the health center, to make sure that the public health emergency system is really functional. So we do this supportive supervision together with the zone, together with the warada. So after the supportive supervision, we also give them feedback just to improve the situation. There is also a quarterly review meeting going on at the zone level with this project. So every quarter, the waradas present their performances, their challenges, and the actions that they're going to take afterwards. So this review meeting focuses on reviewing the public health emergency issues, like reviewing the performances in terms of epidemic-prone diseases. And together with FBK, we conduct research to study how is these communicable diseases, especially measles, transmit to the community. And with that project, we build also the capacity of the zone and the Warada Health Office FEM focal person on how to conduct such kind of studies to respond to public health emergencies. Apart from this, we have also other projects supported by AICS to support maternal and neonatal health services in Southwest Shoa zone, as well as in other regions in Ethiopia. So this is the thing that I would like to say, but I was not prepared to make presentation. I just jumped in because Mr. Merga was not online. Thank you. Over to you.
Thank you very much. So I see that Ato Merga Yemani is not yet back. So if he comes back, I suggest him to add this part later on. I remind everybody in this moment that you can drop your question and comments in the chat, and we will address them at the end of the presentation. So keep your question, and we will have answer from all these stakeholders that are so nice to present their speech. So now from the health sector, we move to WASH with the Urban WASH program. And I welcome Mr. Mengesha Dimer Abebe, Civil and Water Engineer from the Water Resources Development Fund. Can you hear us, Mr. Abebe? He was having some trouble here before with the connection. Can you hear us?
Thank you so much. I'm Mengesha from Water Resource Development Fund. As you said, I'm a water engineer, a degree program in hydraulics engineering and a foundation engineering in MSCC, and working at WRDF as program coordinator. Program coordinator for the Basket Fund program coordinator as WASH other WASH programs. I'm very happy to represent my office here, and very happy to see you on this virtual meeting. In short, I'm going to present what WRDF and what we are working. Sorry for my video is not working because of my laptop's defect. I'm just presenting through my voice. Water Resource Development Fund. Yeah, thank you. Water Resource Development Fund. I think you are hearing me, is that? Yeah, thank you. Water Resource Development Fund is a public body established as a governmental entity. It's managed by the board and ministers from health, education, from Addis Ababa University, from Regional Water Bureau head office. Nearly 9 members of board are in charge of managing Water Resource Development Fund and accountable to the Ministry of Water, Irrigation and Electricity. Its objective is to apply revolving fund program, extending for long-term public loans to Arbans, especially for medium and small towns concerning for water supply and sanitation projects. Of course, as a mandate, WRDF has given irrigation as one of the areas where intervention are made through this long-term loan financing, but so far only one project intervention. As organization, if you see the chart, MOI is ahead, I mean the upper rank, WRDF or then the DG, General Director, and 5 directorates there in place, 3-1-man units. We do have 65 total number of staffs, engineers, financial specialists, auditors, administrators. These are professionals and a lot of other supporting staff. To date, WRDF supervising more than 121 projects, water supply and sanitation projects in urban areas, particularly for this 121 projects in medium and small towns. Of these projects, nearly 22.3 billion allocated for them to construct the projects. As based on the design document, nearly 10 million beneficiaries is going to have access water and clean environment from sanitation intervention. 49 projects are completed so far from 121 projects, and 36 have started repayment. As I have said, the main objective of WRDF is to build up a revolving fund that can address the demand for urban areas for water supply, sanitation, and for some irrigation water association to fulfill the 2030 agenda of our country. To date, we have collected nearly 694 million Ethiopian birr from the repayment, the one who start repayment from their loans. New projects, of course, it's obvious, new projects are coming from sanitation program intervention by AICS support, nearly 6 projects only on sanitation intervention. We will launch, we are under consultants evaluation. Recently, hopefully we will launch it, the program. This is the total overview of our projects. Next, sorry for the inconvenience. I think it's better to, thank you. The most known program that we have a lot of support from Italian Agency for Development of Cooperation. Even the total program support for all the staffs, for all the materials, which is supported from AICS, is a basket fund program. Nearly 48 medium and small towns are financed through this program. In size, 2,200 inhabitants within one town, where this is a modality that the program are set up. at the very beginning. We have two intervention components. The one, basically water source development, drilling or surface water, infrastructure construction. The other one, capacity building for water utilities, especially from the grant part, from the program support part, which is come from Italian Agency for Development Cooperation, supporting the utilities through different kits, maintenance kits, cleaning kits, and the soft component, the program support, training relating to the hygiene, sanitation, and how to manage the water and the billing system. These all interventions, come from AICS. In some extent, from AFD and EIB have some technical support similar for this project, in addition to the solid infrastructure construction. Participation of local and international companies are, specialized in water and sanitation. A lot of companies are come to join to work with us for this basket fund program, which is financed by Italian, France, and the EIB, European Investment Bank, nearly 75 million euro in aggregate, and 6.5 euro as grant for program support. So job opportunities are also the other opportunity that we have gained from this project. WRDF is, executing this program, and the regional water bureaus, upon the delegation by the utility, are implementing the projects. Of course, the capacity building part are handled by WRDF, and the infrastructure construction part is through the regional water bureaus, because they are delegated officially. Thank you. Next slide. I think the last one. The Arban Wash Program, contribution to the SDG, as you see, if we just to have a glimpse, some insight, what's going to happen on some particular towns when intervention are finished, when water supply or sanitation projects are finished in some towns. So just giving you some insight, enlightenment on the intervention, you can see this picture. And it is contribution to the SDG. As you know, by 2030, achieving universal and equitable access to safe and affordable drinking water for all is our objective, and supporting and strengthening the participant of the local community in improving water and sanitation management is also the other thing. If you see one town, Fiche, which was financed by this basket fund program, already the project is finished, and the habitants, the beneficiaries are also enjoying the water by this time. So if you see the sum of the models, nearly 1192 meter cube per day for 42 inhabitants or citizens are, access, averagely 28 liters per person per day. This water comes from 15 springs, and the water is so clean and so tasty, very clean and tasty. Of course, in addition to these 15 springs, which is sustainable throughout the year, 3 boreholes are also supported. If we seek the connection, 2,995 private connections, 34 public water points are also in place for this particular. After this, our intervention, 7,600 meter cube per day for 75,000 citizens are, this is a change. At the baseline is the first part. The second one is after we intervene. In addition to these 15 springs and all 3 boreholes, we have added 8 boreholes, nearly 7,600 meter cube per day for 75 citizens are 100 liters per capita per day. A lot intervention for this particular town. So in general, this is a model, just one of the sample, our interventions through basket fund program. From other programs similar to this basket fund, like CWA Consolidated Wash, and as from other financiers, WRDF are moving forward and working on it. I really appreciate the support from Italian Agency for Development Cooperation. It's not only for this basket fund program. we do have the best experience in the models town, 5 town projects, water supply and sanitation. Before this basket fund program, we get support, a finance from AICS. So for 5 towns, with the best model towns in our organization in water resource development fund, which was financed before 5 years. And they are enjoying the water similar to Fiche. Thank you for this time to present WRD for you. Really, I appreciate and thank you so much. I would like to thank you so much, the AICS, for this support. Thank you for your attention and the time for this presentation and your attention.
Thank you, Mr. Mengesha, and remain with us for the question and the second part of the discussion. So I see a question also in the chat for the previous intervention. We're going to address it, so thank you, Dario. And it was brought to my attention that we have online Atomerga Yemane from the Southwest Shoa Zone. So if Atomerga can hear us, maybe he can jump in now before we proceed with the industrial sector. Atomerga, can you hear us?
Yes, I'm hearing.
Good, welcome. If you would like to say your presentation or your short speech, please, you can go ahead now.
Okay, thank you for the chance I get. Actually, I do have no presentation, but I may clear some short speech on the QAM doctors with Africa support, especially relating to sustainable development goals targets set in Ethiopia. Actually, the QAM doctors with Africa is supporting us in many aspects, especially in reducing the maternal and newborn mortality rate. For the past 2 or 3 years, QAM Doctors South Africa is supporting 20 health centers out of 54 health centers we had in Southeast Shoa Zone. In those 20 health centers, we have get so many supporters in different direction, which is directly related to maternal and newborn care services, especially in capacity building activities. There are so many trainings conducted at zonal level by actually collaborating with the zonal QAM coordinators. This capacity building training is given for those midwife professionals who are giving service at health center level, and also for those health extension workers at health post level. Actually, this capacity building activities given on the topic of especially the antenatal care service to enhance the for the visit of antenatal health service by by capacitating those health professionals and by participating those community leaders at different level, especially how to identify those pregnant women before they get pregnancies, actually before 16 weeks. Before 16 weeks, this one is one topic. The other support is the infrastructure, related to the infrastructure support. The QAM Doctors South Africa project is supporting our 20 health centers by availing clean water in order to avail quality health service for the community, and also in cervical cancer activity, 20 health centers have got the cryotherapy machine to give treatment service for those women who have developed the cervical cancer. So 20 health centers have got the cryotherapy machine, and those female health workers in these 20 health centers have got a training on the screening of cervical cancer and on the treatment area. The other one is actually regarding to the surveillance activity, especially in the current situation. The COVID-19 is a critical issue in our zone as well as at a global level. So for this activity, we have conducted so many sessions with the coordinators. Actually, we have one treatment center at the zonal level. There are so many health professionals in the treatment center. So we are capacitating them how to manage the cases in this facility. And also the very critical and important training we have got from Quam Doctors South Africa is the psychosocial support on COVID-19 case management for the health professionals giving treatment at treatment center. Actually, we have no reported measles and AFP cases in this year, but we are working the community level surveillance activity by PLA project. By PLA project, we are empowering those community leaders, especially women in Goro Rada. For example, in Goro Rada, we are empowering the Gare and 1 to 5 network leaders at this Warada level, and we are strengthening the referral linkage, the identification of the case and the referral linkage to the health center. We have conducted these all activities regarding to the prevention of the communicable diseases like AIDS, tuberculosis, and malaria. Selectively, we are working together on the tuberculosis prevention and control activities. This also by strengthening those community TB activities by identifying the presumptive TB cases and by referring those identified suspected cases to the facility level. So the community surveillance activity is also conducted by Quam Doctors South Africa. The other issue is the CHIS and DHIS activities, especially on the data use activity, how to record the data and how to analyze and report monthly and quarterly reports by capacitating those health center, health informatic professionals, and for those health extension workers at health post level. So the data use, the data quality activity is also conducted by the Quam Doctors South Africa project. So when I try to finalize my opinion regarding to the Sustainable Development Goal targets, we are directly working with Quam Doctors South Africa on maternal mortality and also on prevention of newborn and child under 5 years of age prevention, and also in the control and the prevention of communicable diseases, specifically on tuberculosis. Thank you for your attention.
Thank you, Atomerga, for coming back and for your speech. We now move to the third sector, the industrial one, because we're a little late, but we try to have at least 15 minutes for discussion. So I welcome Andrea De Marco from the Industrial Development expert from UNIDO.
Thank you very much. Good morning, everyone, and salam menachu to our Ethiopian friends. Yes, I'm industrial development expert. I'm a project manager of most of the projects that I have the honor to manage are implemented in Ethiopia, where I live for 3 years. And for the one of you who does not know UNIDO, UNIDO is the UN Specialized Agency for Industrial Development. Our mandate is to promote and accelerate inclusive and sustainable industrial development in our member states. Within the UN SDG, UNIDO mandate is fully recognized within the UN SDG number 9, which calls to build resilient infrastructure, promote inclusive and sustainable industrialization, and foster innovation. As you can probably see here in the picture on the left side, this is how our organization structure its own activities and programs all along the sustainable and development goals. So we do technical cooperation activities, policy analysis and services, norms and standards, and convening and partnerships. Next one, please. Ethiopia is a target country for UNIDO, and UNIDO and Italy has a long-lasting relationship to support actually the Ethiopian government in implementing its growth and transformation plan, and in particular we are working in different strategic sectors for the Ethiopian economy, like the coffee sector, textile, agro-industry, and leather. And probably in the leather sector is the longest one. We started to work on the leather sector in 2001, when UNIDO was supporting the Ethiopian government in defining the leather industry master plan, and then hand-to-hand with the Ethiopian government, the Italian Development Cooperation. We started with the establishment of LIDI, which is the Leather Industry Development Institute, which is the technical arm of the Ministry of Industry. We established LIDI and equipped and capacitated the institute, and then we moved to the direct support of the micro and small and medium enterprises through a cluster development approach. So we are currently implementing the phase 2 of the technical assistance project for the upgrading of the Ethiopian leather and leather products industry. Our objective is to support these micro and small and medium enterprises working on this sector through our cluster development approach. As you can see in the diagram here, the activities can be summed up as reinforcement and enhancement of backward and forward linkages, capacity building activities for improving the quality of the product, technology transfer and premises upgrading, institutional support, so trying to be inclusive and trying to foster the participation of the local institutions like the Ministry of Industry, LIDI, and the Federal Agency for the support of the micro, small, and medium enterprises. And at the end also, another activities which is very, very important where we're working in is to boost the creativity as an engine for the leather sector. Next one, please. We are being honored to receive different different delegations, high-level delegations, both from Italy and Ethiopia, and an Ethiopian delegation, institutional delegation in Italy. But why? Definitely, the leather sector is of paramount importance, not only for the Ethiopian economy, but also for the Italian economy. So that's why we try to replicate or to take the best practices of the Italian leather district. I mean, I can remember some of those. I mean, Santa Croce sull'Arno is a state-of-art model, worldwide recognized, Vigevano, Arzignano, and Scandicci. So these are the models that we are trying to, to focus to and to replicate some of the best practices that we learn in Ethiopia. Next one, please. So as you know, all our programs and projects are aligned and we report focusing on the Sustainable Development Goals. Next one, Laura, please. But naturally, this project is referring to a limited number of SDGs, and particularly support the Ethiopian government in eradicating poverty. So this project was supporting almost 500 companies, 3,800 workers and their families and their families. Work hand in hand with the Ethiopian government in trying to foster economic growth and the creation of decent work. And what we are naturally SDG number 9 is our core SDG, and we are now focusing a lot, especially on the SDG number 17, trying to facilitate the establishment of public-private partnerships in order to ensure sustainability of the action. And in order to do that, we are moving also to the establishment of what we call this creative hub. It's a sort of it's a center, it's a hub in the city of Addis Ababa, where we try to stimulate the participation of young and creative people, and trying to link them with the productive clusters in order to stimulate entrepreneurship development and partnership establishment. Thank you very much indeed.
Thank you very much, Mr. De Marco. Before we move on, I just want to greet and to say goodbye to Miss Isabella Lucaferri, soon our head of office. So thank you for joining us, and it was a pleasure to have you here.
Thank you. I'm sorry, I have to leave. I'm sorry. Yeah. Thanks for your contributions. See you soon.
See you soon. Thank you.
Bye-bye.
Isabella, thank you.
Bye-bye.
And now we can move on with the second presenter from the industrial sector, Mr. Nicolas Tilegesse, Management Committee member from the Ethio International Footwear Cluster Cooperative Society, AICS. Mr. Tilegesse, can you hear us? They had also other slides. If you received them, can you try maybe to show them? Perfect. Mr. Legesse? Let's see. Mr. Legesse, can you tell us if you hear us, or? I can see that he's online, but maybe he's having troubles.
Okay, can you hear me now?
Yes, now we can hear you.
All right, thank you for this event, and thank you for giving me the opportunity to present. My name is Nicolas Legesse, and I am from AICS. AICS is Ethiopian International Footwear Cluster Cooperative Society, which was established in 2006. It's composed of a lot of SMEs, about 100 production, and with employing as of last year, is about 1,409 and about 1,287 male employees. And out of all those, the youth take majority of the employment, which is about 2,436 employees. And we're currently operating in about 7 buildings that are about 4 floors, which is rented from the government. Next slide, please. So the support we're getting now is one about the ideas of cluster work, which the cluster work is the idea of working together to solve our common problems and for the future of our sustainability and for the future of making good products. We also got helps on our issues on the management. Some of the stuff that we also got is our creating backward linkage. We were able to talk to tanneries, glue factories, and salt factories, lower our end. Instead of buying from retailers, we're getting straight from the tanneries, and this is one of the facilitation we got. The most exciting and great help we got was we were able to get about 33 state-of-the-art machineries, which were able to produce about 500 pair of shoes. So before, we really did not have one big factory where we were able to produce quality items for rapid development. But now we have these machines, and it's really a great help. And we were able to upgrade our quality while we're improving our quantity, and that shows on our price. Next slide, please. The other help we got was on it's about the capacity building. We were able to get 2 types of building. One was the hard skills, and the other was the soft skills. And on the hard skills, we were able to get some designing help, pattern development, stitching, and so on. And on the soft skill was the idea of teaching, our members bookkeeping and so on. And on the front linkage in marketing, we were able to participate on different trade fairs. We were able to show our goods, our shoes, and be able to create marketing in that regards. And we were able to connect with neighboring countries as well to develop and to assess on the marketing and different trade shows, and also, in leather product goods as well. We also were able to link with companies that are who are doing the same type of work as we do, the shoe producing companies like Tokorabai, Ambassa, and other factories, and we were able to get some knowledge from them due to the linkage provided. Next slide, please. The other thing that we got help was on how to promoting safe and efficient work environment. For example, the Kaizen philosophy. We were able to get those into most of our workshops and most of our members. And by doing that, we were able to save a lot of areas of usage, how to use our areas properly, and how to avoid wastages and sorts of things like that. We were able to get some ventilation system for our workshops. So by doing that, we were able to create a safe environment and workplace. So with all this help, we were able to achieve the employment growth was almost like 20 to 30%. We were able to make those our production capacity is one of the best thing that happened to us because of those machines that we got. We were able to produce as much, probably about 100% more shoes. Not only that we were able to produce more shoes, but we were able to make good quality shoes as well. So while we increase our capacity, we were able to decrease the cost of our production. And we see that with our profit margins. And so that I would like to say is that we have two great ingredients for success in Ethiopia, especially in our sector, which is the shoe sector. We have an abundant leather goods, and we have a lot of cheap labor. And one thing that we need is how, a help to get linked with other businesses. The B2B linkage is very important because one, we can create, at this point, we can create a good finished goods. And for other companies that don't need the full product, we can also produce a semi-finished goods. And if we're able to get that kind of support, I think we can take this to a different level. Thank you.
Thank you, Mr. Legesse. Sometimes we couldn't hear you, so we'll take the chance of the discussion maybe to tell the participant to ask you a question in case something wasn't clear. So last but not least, now I welcome Mr. Asnake Tibebu, Business Development and Project Manager, and Sara Pini, Country Representative of the CSO Comunità Volontari per il Mondo, for the last section. And Laura, you can go back to their slides.
So good morning to everybody, first of all, and thanks for organizing this meeting today. As you said, I'm here with Asnake, my colleague, which is the Business Development and Program Manager for the project. Yeah. Okay, so we briefly go ahead and we give an introduction on the on CVM, which is Comunità Volontari per il Mondo. CVM has over 40 years of experience in Ethiopia. Is implementing especially two different projects in two different areas, water and hygiene, which means both the construction part of water scheme and also soft components, meaning community-based intervention. On the other side, we are developing a social project. Our main targets are women, domestic worker, migrant, and returnees. The activity that we have implemented so far with those beneficiaries are related to the capacity building, training, professional training, and also reintegration activities for returnees coming back to Ethiopia. We did also some advocacy and sensitization activity on the domestic workers' right. We currently have 6 offices in Ethiopia, just for you to have a brief knowledge of the organization. One is in the headquarters of Addis Ababa, and 3 offices are in Amara and 2 in the southern region. We are talking about 50 staff members involved in Ethiopia. To go ahead a bit with the project, so the project we are talking today is the Ultra project, so UNIDO Leather Cluster Empowerment in Addis Ababa. This is a project financed by AICS and is based on the UNIDO intervention, as we were seeing before on the phase 2 of the project. The overall objective is to improve the capacity building and the job creation of youth and women in Addis Ababa in the leather industry. Leather industry is one of the most Asian activity and also a growing sector here in Ethiopia. So that is the reason why we are working on this specific sector, on the leather sector as well. Talking about the beneficiaries of the project, we are sorry, I think you need to go back on the slide. Sorry about that. The beneficiaries of the project are mainly AICS and LOMI. Those are two clusters present here in Addis Ababa. AICS, we saw the presentation just now, so it's working in the shoe industry, while LOMI is in the bag production. LOMI is a female cluster. We are talking about 220,000 euro for this project, and we have partners both here in Ethiopia, like LIDI, ELIA, Addis Ababa Industrial College, but also Italian partners like SIFI, FP Artigianelli, Dami Shoes, and Lauro Design, which they have years, or sometimes over 50 years of experience in the leather industry. One key area is also to create synergies between the leather industry in Italy with the Ethiopian industry. The project aims basically to achieve two results. On one side, the business creation and quality improvement, and this is done through management and technical training and capacity building activities that are delivered by the Italian expert in the leather sector. On the other side, we have the business development. So we are working on marketing activities to promote and to increase the access to the market. The project and its relation on the SDGs. So basically, we can go ahead with the slide. Sorry. So the project is aligned with the Program for Country Partnership, which is a strategy that has been implemented by UNIDO, and to achieve the target, the SDGs Goal 9. So we are talking about sustainable industrialization. In the specific, this project is focusing on the target 9.3, so increase access of small-scale enterprises, so micro and small enterprises. We are, one of the target of the project is to involve up to 80 micro and small medium enterprises, but of course we are collaborating with the larger group and larger number of enterprises as well. The project is based on promoting a cluster approach through a strengthening of management and marketing training, as well as promoting a business development through online communication, so focusing on brand, social media, and website development. And at the end, we work on the business creation, so and quality improvement, which means technical training delivered, based, for example, on the cutting, on the design, on the hemming, so the different stage and use of the new machine for the creation of new products as well. Of course, the project is also aligned to other targets, which are the 8.5 and 8.6 of the SDG agenda. So we are talking about productive employment and decent working conditions, especially for women and youth. So to reduce also youth unemployment, that is the first objective of the project, and also the target related to gender issues. So the ensure women's participation also in the economic aspect. To this end, we are collaborating with the LOMI, which is a women cluster, and also we are trying to involve as much as we can small medium enterprises managed by women and youth. Okay, thank you very much for the attention.
Very much. Tibebu.
Thank you very much, everyone, and this is a good opportunity for us to have a clear image. Sarah has already said all the ideas that we have in the our project, but just to take a minute to highlight the general overview of our project. The project is the Unity Laser Cluster Empowerment. It works on 2 subcities. The main area that we are targeting to empower in this project is the general empowerment of the sector, which will be implemented working with Lady and Elia, where those institutes are the main stakeholders in the sector. The second main empowerment targets are, as Sarah has already said, LOMI and IFCOS, where those are the first cluster concepts in Ethiopia. So we empower them in 3 main areas, which is quality production, marketing and branding, and the management part. With this main empowerment areas, we have 2 kinds of measures, subtopics that we empower. The first one is to develop their soft skill in management, where we give them business management and marketing training. And the other one is, there is a part where they can have international market expertise exchange, where we connect those clusters with high professionals and experienced stakeholders in the sector. The other one for technical training is the main areas in the technical trainings are 2 parts. The first one is on design, where they learn how to create a new model, footwear model development areas, and the other one is how they can improve the quality. For quality part, there are 2 parts, the upper part and the shoe finishing part. For strengthening the marketing and their communication capacity, we mainly work on their branding tool developments. We also include or empower their visibility in the market so that they can be competent enough and take a market share. We are really emphasizing this part on the social media, so we are very successful on those parts because we have been getting too much followers on our those medias. And the other one, the last one, is we offer them for international market participation, fair participation, where they can learn how they can connect internationally. Thank you very much.
Very much also to you. So we finally have connected also the representative from the Embassy of Italy in Ethiopia, and if the connection is stable, we can maybe give the word to him, Mr. Pietro Panarello, the first secretary. Pietro, can you hear us? We can't hear you. I guess we still have some trouble. So let's proceed. Okay, now we can see the video.
Good morning.
We can't hear you well. Unfortunately, the connection today at the embassy is not a good one. Mr. Panarello, we still can't hear you. Maybe we shall proceed with some questions first, and we get back to you as soon as the audio is better. Okay, so we can move on to the discussion. I can read some questions that arose on the chat. There is a first question to Alessandro Domanico of IT Without Border. Dario Poddiger says, among other things, the COVID epidemic showed the importance of bridging the digital divide worldwide. Even today, we're carried out a festival online. I would like to ask to IT Without Borders, what are the main gaps that need to be filled in the Ethiopia within the IT sector? My question is broadly speaking related to Serveti, but also in general, regarding the digital landscape in Ethiopia and towards the SDG number 9, innovation. Mr. Domanico?
Yes, can you see me now also, I think?
Yes, we can also see you, thank you.
Okay. Thank you. No, yes, maybe the first gap is between Alessandro and Zoom on my computer because it's crashing all the time. Okay, yeah, the topic is quite wide. We should have a specific call for discussing it. About innovation in Ethiopia, are there rooms for innovation? We have to ask ourselves. Yes, there are, and there are many. But all of them, the main gap we found is the infrastructure aspect. And as you can imagine, this one relies on different agents that are economical, social, cultural, and political, especially talking about Ethiopia. If I'm not wrong, the last June, the Ministry of Technology, I cannot recall the name, was talking about the opening up to competition in the mobile market. So there are sure many rooms of intervention, but not always are something that we can address directly. And as there is another side that we like also to highlight, that is the area of intervention for those realities that at best they will not be reached in the short time by any innovation, even if it's from the government. So the rural areas that are at the moment not reached, and our goal is always to fill that gap, because they will not get any chance to receive anything in the short period. And actually is what is giving the most. We can imagine all the programs that are not covering like particular professionals and staff, and yeah, staff in the facility. We work mostly in the health facility, but I think there is everybody the same situation. So those one are the gaps. There are gaps where we can actually do something, and others that we are just to see how the things going in the nation. But I would like also to discuss broadly about this topic, if you like, as well.
There will be probably the chance of doing that in your festival, ESF Festival in Rovereto, in the end of the month. May I do this moment of dissemination? Do I disturb for that?
Yes, you can. You can go ahead very quickly, maybe, so we proceed to the other question.
Thank you. Thank you, everybody.
Lorenzo, do you want to add anything? Seems not. Okay.
I don't know if I answered the question. If you need more, you have more question, please don't hesitate to call in.
Thank you. Thank you. Let's see if Mr. Podige will write something else in the chat. He can't speak, unfortunately. So we have another question in the chat, and this one is for UNIDO, AICS, and CVM. Alessio Bello from AICS says, in Ethiopia, how can local private sector contribute to the SDGs? What are the opportunities and challenges for the local private sector? I don't know who from you wants to take this.
If may I reply, just giving few reflections. For sure, I mean, the economic sector is a driver for the private sector is a driver for economic growth, especially also in Ethiopia, which is a fast growing economy. The private sector can contribute to SDGs through innovation, for sure, and through the promotion of sustainability. So we should remind probably that the SDGs are not only targets for the projects itself or for the institutions, but are even individual targets, let me say. So even each of us and even the private sector itself should have clearly in mind which are the common target that we should achieve. So for sure, I think that Ethiopia has naturally certain problems related, especially with infrastructure and connectivity, and these are essential inputs for the private sector life. So I know that the Ethiopian government is working on that, and the international community is really supportive. So in improving the infrastructural development of Ethiopia. What probably is the common problem of the local private sector is the access to finance. This is always, let me say, probably, especially in this period, okay, and this within this COVID pandemic, the access to finance remains probably the worst problem and the main challenge where we all have to focus in. Not only in Ethiopia, I mean, we can naturally see that clearly also here in Europe, how even the private sector is struggling for this, but in Ethiopia in particular, in developing countries, the private sector should be facilitated also in access to finance.
Thank you. Thank you, Mr. De Marco.
If we can add something, I don't know if it is
absolutely
in relation to this question. So what we would like to say, as it has been said, the private sector is key area for economic growth. We are talking also, especially in terms of job opportunities that are related to the private sector as well, and the capacity building skills improvement that the private sector can bring in terms of economic development. One important factor is also related to the connection between job opportunities and informal market. So bolstering the local private sector means also like reducing the number of people probably working in the formal sector, in the informal market, which is one of the main contributors today to some economy. This will means also like an increase of regulation and rights of the people that are working, and this is very important as well. The other aspect is also probably related to the revenue, so that the private sector can bring to the government as well. And those is an area that we also need to take into account. If you want to add something.
Already has been said. The finance issue is the main challenge. We need to emphasize that, because on our intervention for both clusters, this was the key challenge that we're facing, because they need revolving fund. They need it's not easy to get access for credit, so that they will have stock of
some intervention, it's some contribution to the total SDG target, not the total momentum of our country, Ethiopia. If I just address your question, so 10 million people is only the intervention we have made so far. Of course, we do have a lot of long list of towns that request us to get loan financing, but we have a lot of budget shortage to apply this loan financing for those pending and waiting list number of towns into this our system. The budget is one of the biggest challenge here in our organization. And when you come to the second question that you raised regarding the participation from the community, you see from my presentation, WRDF are acting as implementing agency. We are supporting the region and negotiating and advising them to bring the community's participation into the project. Especially for rural towns, it's possible to have a significant impact from the community's participation. But from urbans, the project is big and it's somewhat complex. Structures are, constructed. Actually, the participation of the community is limited in urban intervention for water supply and sanitation. So the limitation is, on ground. They participate in mobilizing the resource from the local to finish our project, accepting as an owner and giving their lands freely, and providing mobilizing the resource. Are not only mobilizing us even in the communication during the construction. They do have a lot of support on the construction. Saying this regarding the total intervention in Ethiopia, you see the government has a lot of budget for, especially for this year. The government put a lot of money for this, especially for urban, rural areas, water supply and sanitation in other programs. What you see in the picture in my presentation is only for one program, which is addressing only in 4 regions. In Amhara, 4 towns, nearly 4 towns, Tigray, 2 regions, 2 towns, South, 18 towns, and 24 towns from Oromia. By the time when these programs, initiated, when we request the regions to send the prepared documents, only those 4 regions are, issuing those prepared documents that could be possible to launch the program. That's why the limitation, the distribution of the towns in the Ethiopia map that I put on my presentation is somewhat, it shows in some areas only. In the other programs like Consolidated WASH, CWA, like African Development Programs, like FD programs, we do have some other towns from emerging regions, from Gambella, from Benishangul Gumuz, from Somali. We do have other towns from other programs. Sorry for the partial presentation of putting those towns which have been considered in our organization in that map. I think my presentation gave you a misunderstanding. Otherwise, the distribution of the towns in Ethiopia from my organization, from here in WRDF, I've even almost, except in one region, in Afar region, almost in all regions, we have projects. Recently, a proposal from Afar region arrived in my office here in my coordination, where we are planning to finance through the collected revolving fund for this particular Afar region. Otherwise, what you see is not the total towns. What you see on the map is not the real presentation of the total projects that we have had an intervention for water supply and sanitation. I think this is clear for you.
Thanks, Mengesha. Really, you have replied to my questions. I know, of course, that you have your PowerPoint presentation was not complete, full of details. And thanks for the explanation, by the way.
Thank you. Regarding this foreign currency, somebody have presenting the issue of this foreign currency impact on project implementation. It's real, but in our case, especially, almost all the projects are financed from external financiers, from Italy, FD, AIB, African Development Bank, World Bank, UNICEF, UNDP, like that. We use those opportunities to open LDCs, and the effect of this LDC process, those projects, urban projects in my office here at WRDF is not that much big because of the support from the foreign currency, from the financiers. Thank you.
Thanks to you again. Now that the questions are over, I would like to know if somebody from the attendants that are with us today would like to raise any question or any comment not relating to the presentations, but in general regarding the title of this webinar. So focusing on really how Ethiopia can really achieve the SDG. There is somebody that would like to share with us his, her opinion on this regard.
Can I?
Of course.
Yeah, I'm Mangesha. Yeah, I'm from WRDF. Really, we appreciate, on one hand, COVID has a lot of life loss, but on the other hand, it brings such an awesome way of communicating with our precious, stakeholders, financiers, and development partners. We're very happy to get in touch like this. And I'm very happy to present even today regarding my office's stand and the way the implementation are handling and the way we communicate with you. And all the presentation I have seen today is very, very wonderful. And I really thank us for all the participants. I have got a lot of insight. Even some organization I have seen today, I haven't known yet so far. And I keep in touch with you because hopefully we will have some possibility of working together with you, and I will keep in touch. And on the other hand, having you easy of communication with you and reflecting our intention, our concern, our question, using such a platform is very important. I suggest keeping in touch like this is very, very necessary in the upcoming days. Thank you for the time and your attention and for your concern for Ethiopia.
Thanks, Mangesha, for your comment. So if there is somebody else who would like to share with us any kind of... Yes, Lorenza, please, the floor is yours.
Just to say thank you as well, Mangesha. I agree completely with Mangesha. It has been a very beautiful occasion to know each other and to share all these experience, which is so important for the present and especially for the future. Thank you very much.
Thank you to you. And I would like just to remind you that the Italian AICS Addis Ababa and the Embassy of Italy in Ethiopia has decided to organize this webinar because we really think that a global partnership is necessary to address the global problem and to find the global solution. I think that through the COVID health public emergency, we all learned this. And we have been trying to show to you, to our friends, how the AICS funds are being implemented in Ethiopia through different institutional organizations. And I think that we have at least see how these funds are being utilized and how we are contributing to reaching the SDGs in Ethiopia. So thanks again for everybody for the presentations and for the participation. I would like to give now the opportunity to finally speak to Pietro Panarello from the First Secretary of Ethiopia, of the Embassy of Italy in Ethiopia. So please, Pietro, if you are able to talk, please.
Can you hear me?
Yes, we hear you. Perfect. Go for it.
Fantastic. Fantastic. To set up the video, I'm sorry. Okay, now you can hear me. I hope you can see me now.
Yes, both.
Okay. Okay. Hi, everybody. I'm sorry for the delay, but due to problems with the connection, I couldn't be present before. I'm very glad to be here with you to represent the embassy. I want to greet on behalf of the ambassador Arturo Luzzi, and I wish to say hello to everybody, in particular to the new director of Italian Development Cooperation in Addis Ababa, and Mrs. Isabella Lucaferri, and to all the participants, especially Mr. Tibebe Akalu. On my behalf, I wish only to highlight that obviously we are assisting, we are witnessing an historical moment for Ethiopia that started, we could say 2 years ago, with the appointment of Mr. Abiy Ahmed at the government. But at the same time, it's important to witness, to highlight that Ethiopia has been addressing continuous economic growth over the last 20 years. So it's a country that is aiming at turning as middle-income countries within 2030, I'd say. And concerning this process of transformation, of course, we cannot forget the various attempts of reform by the economic agenda that was introduced last year in September, aiming at transforming Ethiopia from a prevalent rural country in a modern industrial economy. And to understand the situation in Ethiopia on the economic side, is important to understand that, of course, agriculture is still 70% of the GDP, and is to transform Ethiopia towards a more modern economy, passes through a series of not only of economic reform, but also of investment in development cooperation at relieve the situation of the rural areas. In this vein, I think that it is very important the country framework that has been carried over the last few years. I try to address the main aspects of the in the agriculture areas. At the same time, addressing especially the agro-industrial parks that represent a sort of trade union between the development of agriculture, to draw a line about the perspectives of Ethiopia over the next few years. of course, we have to start from the perspectives represented by the process of economic reform that has started in the last 2 years. Actually, there is an ongoing process of liberalization of certain sectors that before were mainly state-owned, and of course the international investors are very attentive in this process, and of course the first openings that have been allowed by the governments last year and this year in some sectors, especially logistics, transport, and represent a first attempt of reform. But at the same time, we are very aware that the process of reform represented by the homegrown economic agenda is very peculiar, because it's not the typical process turning from, let's say, a state-owned economy towards a liberalized economy. But is very specific because it could be defined as the government of Ethiopia stated last year. The officials, I mean, the representative of the office of Prime Minister, a sort of a third way, an Ethiopian way toward the developments. We think that considering the peculiarities of Ethiopia, the specification of this reform, because of course to relieve millions of citizens from poverty is a process that a good amount of investment from the government, from development cooperation agencies present in Ethiopia, as well as international organizations. I mean, I'm convinced. I think that Italian government is convinced as well that the double track between public and private investment is very important in order to ensure that a new diversified economy, as well as Ethiopian one is aimed to be, can be, I mean, addressed and boosted in a proper way. So I think that this year has been a year, of course, of a wait, because due to the global pandemic, of course, Ethiopia was abruptly affected by the crisis. But I think that the next year will be very important in order to understand the route. I mean, that will be gone through by the government in order to aim to the objectives of economic reform. I'm sorry for again for the delay, and I hope that the discussion has been. I'm sure that has been very productive, and again, on behalf of the embassy, the ambassador, wish to say hello to everybody, and thanks for the participation in this important event. So, thank you.
Thank you, Mr. Panarello. Thank you. We're really glad that you made to join us. And sorry, I had some technical issues, so thank you, Laura, for stepping in. We have finished this webinar, so I'd like to thank all the speakers, all the authorities, the participants, and ASviS to give us this opportunity within the festival. So I left my email in the chat, and if you have any special requests, you can drop me an email to that email. Thank you very much, and have a nice day to everyone.
Thank you too.
Thank you. Goodbye.
Bye. Goodbye.
Bye. Thank you. Ciao, ciao, ciao.
Bye. Thank you.
Bye. Goodbye. Thank you very much.
Bye. Bye, everybody.
Bye bye. Have a nice day.
Okay,
Bye.
ciao.
Thank you. Bye.